Rother Valley, one of the Rotherham seats, and I'm your host this lunchtime. I've just got to say a few words. I'm going to introduce Mark Koziol from the PDA, who's going to speak after me, and then Jonathan Ashworth is on his way. He's the Shadow Secretary of State for Health, so he should be with us, we think, in the next few minutes. Probably not going to talk about the Charter, Mark can do that, but maybe just about why I got involved in community pharmacy. One of the reasons I chair the all-party group here in Parliament is because I passionately believe that pharmacy, especially community pharmacy, is a vital part of the National Health Service primary care system, and its capability needs to be fully utilised. And I'm not clearly saying that, in my views, it is not fully utilised at this stage. My objective on taking over this from 7 years ago now was to make sure government recognises that value within community pharmacy and makes the most of it in the interest of patients, the public and the National Health Service as well. I want to see community pharmacists' clinical expertise better used. Dispensing prescriptions is not the be and end all for pharmacy. The supply of functions should be a platform from which you provide a range of important valued services. I have to say, I've spent a number of years as a lay member on the General Medical Council and touched a little bit in terms of the education of our doctors here in the UK. One of my first visits I did as chair of the all-party pharmacy group was up to the Huddersfield University to look at the degree courses for pharmacists there, and how impressed I was in terms of what they know about compounds. And I hope there's no doctors in the room here, but in terms of what was asked of doctors in doing their degrees, it were, and doing their training to be a GP, was far less in terms of the hands-on activity that there were with pharmacists and understanding how things act as well. Community pharmacy should be really a pivotal provider of personalised care for people with long-term conditions. 70% of expenditure here in the National Health Service in the UK is spent on long-term conditions, and yet we still haven't got decent systems for looking after them in communities. These people who have known they've had long-term conditions for a long time, some knowing it will develop to further long-term conditions as well, and yet the way we approach it isn't very good at all in my view. I've always felt that community pharmacy are ideally placed and have the expertise to provide the advice, treatment and the coordination of medication that people with LTCs so badly need. And you should be the first port of call for people with minor or non-urgent health needs, providing advice, over-the-counter medicines and signposting services to other parts of the National Health Service as well. And of particular importance to me is community pharmacy should be the local hub for promoting and maintaining health and well-being. We can see encouraging glimpses of that through the Healthy Living Pharmacy initiative, but there's a long way to go as well. If anybody asks me what I've been doing in here for the last couple of decades now around health matters, it's been on public health issues, and anti-tobacco in particular, both by promoting and sometimes upsetting my own government by putting amendments down to pieces of legislation that should have been better. The smoking in public places was one of them that I led changes on from the floor of the House, as it were. And if we don't really get serious about public health, and if we don't get really serious about population health, and this is where I see that pharmacists play a massively important role in looking at the needs of the population that are around them and making sure that we change the contract so we can use pharmacist professionalism to improve population health. Because if we don't, that big hospital you see across the river here, that everybody says it's all in crisis once again. When has the acute sector of the National Health Service never been in crisis? And I have to say, that is because the system and health style and everything else drives people into the acute sector of the National Health Service. And we've got to get communities, keep people out of there if we're going to survive, and if that's going to survive as well. It's a big challenge. It's a big issue for people. People don't like being told what to do by and large. No alcohol on today, full man's there, Mike, I have to say, but I do like a drink. But you know, everything has got to be done in perspective, and I see community pharmacy as delivering what the 2012 Act said, the Health and Social Care Act. I volunteered to go on it. You rarely volunteer to go on any committees in Parliament. I volunteered to go on that when there was a change of government back in 2010, and they talked about reducing health inequalities, and they talked about population health. It's actually on statute. I hear very little of ministers or others talking about that now, and that we have to change. And I see community pharmacy, that should be a leading light in changing that. Hopefully we'll see changes in the national contract that's going to reflect that and make sure that we have a better population and not the crisis in healthcare that we seem to have every year since I was born. I'm going to hand over now to Mark, and hopefully, Jonathan is just coming through the door. I'm going to hand over to Mark first. Mark?
Lords, Members of Parliament, fellow pharmacists, colleagues, ladies and gentlemen, I'd like to welcome you on behalf of the PDA, if you don't wear glasses, to the Safer Pharmacies Charter. If you do wear glasses, I'd like to welcome you to the Safer Pharmacies Charter. We are a trade union for pharmacists. Many of you will know that we've got 27,000 members. The vast majority of these are coal-face pharmacists working every day in practice. And the proposals that we made today on our Safer Pharmacies Charter are based on our involvement in supporting typically 5,000 pharmacists every year who run into some kind of a problem. This might be a civil claim in compensation, it might be an employment dispute, it might be a criminal episode. I know there's debate in Parliament going on about decriminalisation at the moment. That's tens of thousands of cases over the last 15 years, representing a huge and valuable minor data giving us detailed understanding of many of the causes of untoward incidents that end up harming the public. What we have learned is that sometimes the vitally important job of the pharmacist is not fully understood by the public. In our view, it's not always fully understood either by the Department of Health. And when you contemplate that the General Medical Council undertook a piece of research work in 2012 that alluded to the fact that 1 in 8 patients who collected a prescription from the GP had a prescription that contained an error. Now that's a whopping 12.5%. Now what we as pharmacists all know is that the wrong medicine given to the wrong patients or the wrong combination can cause harm, it can even cause death. So the good news is, by the time these patients leave the pharmacy, this error rate has been dropped, reduced by pharmacists to 0.0004%. Now this is an extremely valuable component of the patient safety profile delivered by pharmacists in this country. How does this good work happen? Well, what the public perhaps rarely considers while they are sometimes double parked and waiting to collect their bag of medicines is that pharmacists are working really hard to undertake those important safety net checks, reducing the possibility of harm being caused to patients, checking for correct doses, quantities for the specific condition, for the age of the patient, because they're all going to be very different, looking out for dangerous interactions that may occur, adverse drug reactions from the medicines that have been prescribed, assessing the impact caused by conditions that they're suffering from. They will change the metabolism in those patients, by the allergies that they may have or some other form of contraindication. Frequently, when pharmacists see those patients coming through the door in their pharmacy, they can often tell from that patient's pallor, their colour, sometimes even their size, or it might be another factor such as the advanced stage of their pregnancy. This will provide them with even more clues as to what should happen next for the pharmacists to prevent danger and harm occurring. And often because of this detailed knowledge that pharmacists have of their local community and specifically the condition of many of their individual patients, they will be able to make very, very important clinical interventions, which at the very least can prevent an untoward incident occurring, perhaps even an unnecessary hospital admission or worse. Now this local knowledge of those individual patients is an extraordinarily important part of the safety operation. Just imagine the benefits to the public if you could apply more of it, and the damage if you got rid. Robots. There are those that say that robots based in a central warehouse some miles away can dispense more accurately than humans. Well, they may be right, but do we really want a prescription with a mistake on it, dispensed miles away in a warehouse by a robot, replicating the mistaken instructions of the GP with 100% accuracy and then delivered by Amazon to the patient, when it could instead be handled expertly in the way that I've described by a pharmacist who sees and knows the patient in the pharmacy setting? Now, we know that patients benefit most when pharmacists focus upon using their unique skills around medicines and doing what is most important to patient safety. From the thousands of episodes that we deal with as a defence association, we know that pharmacists are often hampered in doing this. Sadly, whilst the numbers of prescriptions are growing, the resources that they work in are getting smaller and smaller. Staffing levels are reduced, trained staff removed to cover other parts of the pharmacy, targets to sell items or hit other commercial imperatives are often forcibly imposed. And as the valuable safety net service starts to break down, mistakes may not be picked up and patients may endure harm. Now, pharmacists join their vocation because they wanted to help patients, but increasingly they are working in a system which they know can be suboptimal, forced to work in a way where they must start to make decisions about perhaps taking shortcuts in safety procedures. This potentially exposes the public to unnecessary risk and also places intolerably a burden on the mental health of pharmacists because they know they can put patients in harm's way. Surely it shouldn't be like this. Imagine if you were a passenger getting onto a commercial flight. You'd be really, really worried if you saw the co-pilot at the back of the plane selling the duty-frees. Or if you were getting onto a flight that's just coming from New York and you knew that the pilot had just flown for 6 hours, but the flight was being turned around and the same pilot was flying the plane back without any rest, you'd be really upset. If your mother was going into an operating theatre and you were told that the anaesthetist was on holiday, but that no arrangements had been made to secure a replacement, you'd be very angry. But if you were also told that a third of the entire operating theatre staff complement would be working today in accident and emergency because it was busier there instead, but nevertheless the operation was still going ahead, you'd be very, very upset. You wouldn't tolerate it, the respective regulator wouldn't allow it, so why should we tolerate this or similar in pharmacy? Why should we tolerate key members of dispensary staff being redeployed to the checkouts? Why should we expect the pharmacist to work 8 or 10 hours, sometimes even more, without any rest breaks whatsoever? We all know that sometimes members of staff will unexpectedly fall ill. There's nothing you can do about that. But why is it that some employers do not take on cover staff when key personnel are on planned leave for holiday, or worse still, even on long-term maternity leave? Pharmacists cannot consistently perform their excellent and detailed safety work in this kind of an environment because this leads to a diminution of patient safety. Now, recently cuts in the community pharmacy global sum were imposed by the government. I guess somebody was thinking, if we cut the global sum by X, we'll see a reduction in the number of pharmacies by Y. But this is a terrible oversimplification. What's not really been considered is that while some pharmacies have already started to close, many more, a large number, are now going into survival mode, doing their utmost to make ends meet. Forced to cut a corner here, a cost there, a member of staff somewhere else, they have no choice. This is the kind of thing that may just about enable their pharmacy to cling on and survive financially, but it is precisely the kind of arrangement that erodes the important work that we described earlier. Yesterday in this House, the government in committee considered the beneficial impact of new legal defences being given to pharmacists to enable them to defend themselves from criminal prosecution in the event they make an inadvertent dispensing error. 10 years the government have been working on this plan, arguing that the resultant 100% increase in error reporting will produce a 30% reduction in errors because of all the new learning that will occur. Now, we don't want to detract from this important legal defences work, but we don't need a 100% increase in error reporting to learn about and understand the reasons why errors are occurring. It will merely tell us what we already know. What we need is a will to make changes in the system to make pharmacies far safer. They're already safe, but we need to make them safer than they already are. In at least one of the largest community pharmacy multiples, their electronic incident reporting form, which asks pharmacists to record the reasons why an error has occurred, has removed the tick box that allows pharmacists to cite staffing shortages in the dispensary being the cause of the error. It's unacceptable. Based upon the learnings that we have already gained through handling tens of thousands of episodes over many years, we know that if we want to prevent errors slipping through the safety net, then we need to deliver some urgent but extremely effective changes to the safety profiles of pharmacies, especially around the quality and quantity of staff. We deal with these things that have consistently been the root cause of errors in the past in this Safer Pharmacies Charter initiative. Now, I won't go through every single one of these points because you all have a brochure, but I will dwell on the third point here, which is access to a pharmacist. The plan to operate a pharmacy in the absence of a pharmacist is one that the Department of Health has been considering for more than 10 years. We say they really must try harder to understand what the pharmacist actually does in relation to keeping patients safe. The public expect and deserve a pharmacist to be in the pharmacy at all times. A pharmacy without a pharmacist is never going to be as safe as a pharmacy without a pharmacist. So, today we're committing to 3 things. Firstly, in the coming weeks, we will be consulting with employers and seeking government support to get a wide-scale commitment to our Safer Pharmacies Charter. The second thing is, we want to work with and help the regulator to make this happen. As healthcare professionals, we all know it's far more important to focus on the causes than upon the symptoms of a condition. And this is a principle we would like the GPHC to adopt. What's the point of disciplining a pharmacist for a dispensing error if the reasons why this error occurred are not being addressed or acted upon? The GPHC have always said the best way to protect patients is by underpinning the professionalism of pharmacists. We want the GPHC to support this Safer Pharmacies Charter. We want them to underpin the professionalism of pharmacists by actively encouraging employers to create the kind of working environments that lead to better safety experiences for patients. And finally, we will be encouraging all of the profession's representative bodies to join in the creation of a combined advertising campaign, because we want to raise the awareness of the public as to the important and valuable safety role being undertaken by pharmacists whenever they present their prescription at the pharmacy. So in conclusion, we fully know that some of these proposals will be challenging, especially for employers. But far from discouragers, we think that we should be able to galvanise the sector and use some creativity and joined-up thinking. We say that the public should be very, very reassured by the vitally important safety work already being done by pharmacists, but there can't be anyone in pharmacy who would dissent from a central message which says, let's make pharmacies even safer, nor anyone who could support any plans or proposals that could result in a reduction in patient safety. We look forward to working with our supporters in this House, our colleagues in the profession in the coming months, to try and work out how best to implement our Safer Pharmacies Charter. I'd like to thank all of you for coming along today, and I'd like to thank Kevin Barron for supporting pharmacy in the stalwart way that he has for so many years. I'll hand back now to Kevin.
Well, thanks, Matt. I just want to say, as chair of an all-party group, and that is different political parties as well, I don't think any of us would have anything to disagree with in terms of what Mark just said, and particularly around the issue of access to pharmacy as well, and that's a big issue, as you all know. I'm not going to go into what's happening currently at the moment, but that is something that the all-party group has done a lot of work on in the last few years now. No doubt we'll carry on doing so as well. The next thing I have to do is to invite the Secretary of State, its shadow Secretary of State, all-party political shadow Secretary of State for Education, Jonathan Ash.
Health.
Is it still?
Health.
Shadow Secretary of State. Jonathan. Shadow still. Leicester Sale.
Leicester South.
That's right. Okay, Jonathan, sorry. Please.
Well, still shadow, Kevin, although given what's happening with the DUP and the Prime Minister, God knows where we'll be by the end of the day. So, it's a real pleasure to invite all of you here to the House of Commons, and to be invited to say a few words by the Pharmacies Defence Association. It is a real honour. And I'm delighted that there are so many parliamentary colleagues here who do tremendous work, speaking up for pharmacists, not least you, Kevin, in your work with the APPG. We've got Lord Roy Kennedy here, who's speaking out very strongly in the House of Lords. Julie Cooper, who's a shadow health minister in my team, and before she came to this place, used to run her own pharmacy with her husband. So very rare for a politician, somebody who actually knows what they're talking about when they become a shadow minister. And it's I'm delighted to be here on behalf of the Labour Party. And can I say, as the Shadow Secretary of State for Health, I entirely endorse this Safer Pharmacies Charter, and I'm absolutely delighted that you've launched it, because I think it's really needed. In the health debate, we talk a lot about patient safety now, and safe staffing issues. It's really come to the fore politically in recent years. But when we have that debate, we tend to focus on the acute sector, because that is where some of the most serious and upsetting breaches take place, and that's entirely understandable. But I think it's absolutely right that you have launched this charter and you are beginning this debate, because we need, I think, down here, greater recognition of the pressures that you're all under in your community pharmacies across the country. Pressures that have been exacerbated recently by the cuts to the grants that you get from the government. And actually one of the first campaigns I was involved in when I was appointed as the Shadow Health Secretary, just over 12 months ago now, was to speak out in the strongest possible terms against the cuts that were taking place to the grant that you get. We had the campaigns in the House of Commons, we brought motions to the House of Commons. I was actually rather put out that the Minister at the time highlighted Leicester as a city that had too many pharmacists, because I'm a Member of Parliament for Leicester. And we pushed very strongly, and of course, as we know, the government managed to carry on with its cuts, and actually its cuts, when you look at, are supposedly part of the £22 billion of efficiency savings that the NHS is being asked to find. But I think that reveals the short-sightedness of these particular cuts, because it is not efficiency to ask you to do more and more on less and less. There were warnings at the time that many community pharmacies across the country would have to shut up shop, but we certainly know that all of you are, as we've just heard in such graphic terms, being forced to cut corners, being forced to cut back on services that you've been offering to your community, sometimes having to tell to some of the elderly patients that you deal with that some of those deliveries that you've been doing for free for many years, you have to cut back on. Sometimes letting go of staff, good staff, loyal staff who've worked with you for many years. And of course, as we've heard, that often puts more pressure on the qualified pharmacists, taking them away from doing the sort of the practice that they want to do. So look, we are absolutely committed as a shadow health team who aspires to be the next government, and I aspire to be the next health secretary, of reversing those cuts for the community pharmacies grants, but also working closely on these safety issues you're highlighting today. I think where we can find innovation, then we should embrace it, of course. But as you were quite rightly saying, robots and machines can never ever replace the very, very particular human interaction that a community pharmacist has with their patients, who they know, who they understand, who they've often dealt with for many, many years. I see this for myself in Leicester, where I represent arguably the most diverse city in the country. And as I'm sure you won't be surprised, because we are Leicester, we have many elderly residents in Leicester whose English isn't so good, and actually as they become older they lose their English, they go back to their mother tongue, whether that be Gujarati or Punjabi and so on. It's actually the community pharmacists, because of the demographics of Leicester, who can talk to their elderly patients in Gujarati and Punjabi, Urdu, or whatever language it happens to be. That is a sort of added value that very rarely gets measured in the surveys and the analysis. But I tell you something, it's an added value that will be completely lost by robots and drones delivering medicines from a big warehouse to those patients. So I'm absolutely convinced that the role that community pharmacy plays in our wider health landscape is absolutely vital. And as we're about to go into a very serious winter again, in fact, winter starts this week, we start getting the winter statistics this week, would you believe? We will all know and we'll all see the pressures on the acute sector. We'll all know and we'll all see the pressures on general practice. And we know that one of the solutions, not the only solution, but part of the solution to relieving those pressures on the acute sector and general practice is well-resourced, well-run community pharmacies in all of our towns and cities and villages. So that is why I'm absolutely delighted to be here and to offer you my support and solidarity, to commit to you for working closely on this charter and continue to speak out on your behalf. I know from when I visit community pharmacists in Leicester, or indeed when I visit community pharmacists across the country, I was in an award-winning one in the Bristol area very recently. I know, because I've seen it, the tremendous impact that community pharmacist had, and if it wasn't there, or if the staff were forced to cut back on the service they offer, that patients and people in that area, their health care would suffer, and the wider health economy would see more strain on it. So you've got my full support. I hope the government will take up this charter as well and push ahead with it. We will certainly push ahead with it. We think you do tremendous work. We really rely on you. So can I finish by thanking all of you, especially ahead of what I'm sure is going to be a very busy, pressured and difficult winter. Thank you very much.